Non-hemorrhagic strokes are also called ischemic strokes. These occur as a result of an obstruction within a blood vessel supplying blood to the brain. The underlying condition for this type of obstruction is the development of fatty deposits lining the vessel walls. This type of stroke accounts for 87% of all stroke cases. Ischemic strokes can be broken down into two subtypes regarding the type of obstruction in the brain. These two are called cerebral embolism and cerebral thrombosis. Cerebral thrombosis refers to a thrombus that develops at the clogged part of the vessel, while cerebral embolism refers generally to a blood clot that forms at another location in the circulatory system, usually the heart and large arteries of the upper chest and neck. A portion of the blood clot breaks loose, enters the bloodstream, and travels through the brain's blood vessels until it reaches a vessel too small to let it pass.
A person's susceptibility to stroke is highly dependent on several risk factors, most of which are controllable. Those risk factors include, but are not limited to, history of heart disease, hypertension, exposure to cigarette smoke, sedentary lifestyle, inadequate diet, and diagnosis of diabetes. In order to minimize the possibility of a stroke or the formation of an embolism which may cause a stroke due to these risk factors, it is encouraged to engage in 30 minutes of moderate exercise daily, consume a diet low in sodium and fat but high in potassium, abstain from or cease cigarette smoking, and comply to pharmacotherapy for hypertension or diabetes.
If you experience any of these symptoms, please call 911 or go to the hospital immediately. Sudden numbness or weakness in the face or limbs, confusion, trouble speaking or difficulty understanding speech, trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance, lack of coordination, or a severe headache. A well-known test that is a good way to recognize if a person is having a stroke is the Act Fast test. That is FAST. F stands for face. Ask the person to smile. A stands for arms. Ask the person to raise both arms. S stands for speech. Ask the person to repeat a simple phrase. T stands for time. If you see any of these signs, call 911 immediately.
A stroke is a medical emergency, so when you see the signs or symptoms of a stroke, go to the hospital or call the emergency medical number of your area immediately. In the United States, the number to call is 911. Many people do not call or seek medical attention after the first warning signals because sometimes the symptoms go away and come back and go away again. However, in order to prevent a stroke from occurring, you must attend to these signs immediately. It is also important to get medical attention right away because the sooner a person comes to the hospital after experiencing their first signs of symptoms, the more effective and less invasive their procedures of their treatment will be. Overall, make sure you do not ignore signs and symptoms of a stroke and go to a hospital or call 911 immediately.
I also want to remind you that you have a follow-up appointment with Dr. Montezuma in neurology who will check up on your brain health. The appointment is on Wednesday, October 31st at 4:40 p.m. at the Calpulli Center. The Calpulli Center is located at 5500 Campanile Drive in San Diego, zip code 92182. If you have any questions or would like to contact Dr. Zuma, the office number is 619-594-1234. It is extremely important to call 911 and contact Dr. Zuma immediately if you begin to experience signs of recurrence, such as slurred speech, impaired vision, dizziness, and numbness or weakness on one side of the body.